Okay. Let's review the structures naman ng fish heart, specifically that of the shark. So this is the heart of the shark, contain its pericardial cavity. In our plastinated specimen, this is the heart contained inside the pericardial cavity. So how many chambers do you think? 4 din. Contrary to what some sources in the internet will say, na 2 chambers lang. Actually, the fish heart, specifically the shark heart, also has 4 pumping chambers. So, the first one, this plastic, and if it's intact, when it was intact, this was triangular. So that plastic chamber is the sinus venosus. Sinus venosus. So all of the deoxygenated venous blood coming from the shark's body will pass through the sinus venosus. And then after the sinus venosus, blood will pump dito sa chamber na to. This is the atrium. There's only one atrium in the shark. So mas visible siya on the dorsal side of the heart, the atrium. And then next, which is more visible sa ventral aspect ng heart, the ventricle. And then lastly, the fourth chamber is this structure here, the conus arteriosus. So sinus venosus, atrium, ventricle, conus arteriosus. So when some sources will say na the fish heart has only 2 chambers, they refer to the atrium and ventricle kasi yun na lang yun na retain na chambers sa amniotes, sa higher quote-unquote higher vertebrates. So meron na lang tayong atrium at saka ventricles. Nag-disappear, or rather more accurately, na-reduce yung other chambers primitive chambers ng shark heart, like the sinus venosus. For example, the sinus venosus, although wala na siya dito sa mammalian heart, it left a structure inside the wall of the right atrium, consisting of population of cells that can self-excite the heart, yung tinatawag na pacemaker cells. So yun yung sinoatrial node kung tawagin. So obviously hindi natin makikita siya using gross anatomy inspection, but histologically and electrophysiologically, those cells exist within the right atrium as the pacemaker cells. That's the reason why the heart can contract rhythmically on its own even if you cut the innervation. So yun yung parang homologous structure ng sinus venosus in the mammalian heart. Right? What about the conus arteriosus? So, refer natin dito sa plastinated specimen. Yung dalawang parang lobes na yun yung atrium. Itong malaki on the ventral side, that would be the ventricle. This one is the conus arteriosus. The conus arteriosus became split in the case of the mammalian heart. Let's refer to the toy heart specimen. So yung conus arteriosus, single structure in the fish heart, became split into 2 arterial trunks in the mammalian heart. The pulmonary trunk and the aortic trunk. So yun yung homologous structures ng conus arteriosus in the mammalian heart. The pulmonary and the aortic trunks. Right. And then, so the shark heart is a one-way pump. Meaning blood will flow from sinus venosus to conus arteriosus and will not go back until na-deliver na sa rest ng body. So it's unlike in the mammalian case na may double circulation ka. One to the lungs and then go back to the heart and then to the systemic circulation. So once na na-reach na yung conus arteriosus, the blood will flow through this ventral aorta. So that straight tube there is the ventral aorta. This is the ventral aorta. Question: is the blood oxygenated or deoxygenated at this point?
Deoxygenated.
Oxygen poor pa rin, right? So ventral aorta, and then from the ventral aorta, blood will now go to each one of the gills, via the afferent branchial arteries. And then from the afferent branchial arteries, blood will flow through the gills, pick up oxygen, and will now be collected by
Afferent
so the dorsal
brachial
side.
artery.
Afferent branchial arteries. So from ventral aorta, afferent branchial arteries, and then those afferent branchial arteries will unite on the dorsal wall as the dorsal aorta. The dorsal aorta will supply the blood to the rest of the body until they will return to the sinus venosus. Yung mga afferent branchial arteries at saka afferent branchial arteries and their continuation sa gills, they're called as aortic arches. So, aortic arches yun. Kaya nga, more like it's recommended to refer to this arch as the arch of the aorta, not aortic arch, to distinguish it from the aortic arches na matatagpuan sa fishes. Right, so the arch of the aorta, so may parang prestige siya, parang mga Ateneans, di ba, they want to call themselves the Ateneo, not Ateneo. No, parang the arch of the aorta. Yung afferent at saka efferent branchial arteries, part yun ng aortic arches. So primitively, there are 6 aortic arches. So the shark has retained 5 aortic arches. Pero when the circulatory system of fishes have been modified in tetrapods, so syempre when di na tayo gill-respiring organisms, lung-based na tayo. So yung ganyang klaseng circuit has been remodeled. Right? And some of those aortic arches left a relic or homologous structure in the mammalian heart. So for example, the 4th aortic arch of fishes correspond to the arch of the aorta. And then the 6th aortic arch in fishes have been remodeled to supply blood to the lungs. That would be the pulmonary arteries. So homologous yun sa 6th aortic arch natin.